الدكتورة بشرى شاجع، واحدة من الكادر اللي كان مميز في مستشفى الثورة، معتزين أنه تعرفنا عليها في هذه الأيام عندما كانت مقدمة الماجستير. Her talk.
Good afternoon, everyone. First of all, I want to thank Prof. Zaid Atif for allowing me to present my research. Also, I want to thank Chairperson for this nice presentation. Really, I'm so pleased to be here today. Okay, I'm going to speak about my research. Diabetes mellitus duration and the severity of coronary artery disease in cardiac center at Al-Thawra Hospital in Sana'a. Diabetes mellitus is a worldwide metabolic and vascular problem. The prevalence of diabetes mellitus for all age groups worldwide was 2.8% in 2000. It is estimated that this will be 4.4 in 2030. Cardiovascular disease is a major cause of death among diabetic patients, and the gold standard procedure to diagnose the cardiovascular disease is coronary angiography. The general objective of this study to study the impact of the duration of the diabetes mellitus on the severity of coronary artery disease. Specific objectives to describe the demographic characteristics and risk factors of studied patients, to determine the extent and the severity of coronary artery disease in diabetic and non-diabetic Yemeni patients, to compare the left ventricular systolic function between diabetic and non-diabetic patients. Study design was descriptive, cross-sectional, was in cath lab at Cardiac Center, Thawra Hospital, Modern General Hospital in Sana'a City, Yemen. We include all patients who underwent diagnostic and therapeutic coronary angiogram, and all these patients divided into 4 groups: non-diabetic patients, diabetic patient with less than 5 years, diabetic patient with 5 to 10 years, and diabetic more than 10 years of diabetes mellitus. We exclude patients with previous coronary intervention, also patient with coronary artery bypass graft. Also, patients with type 1 diabetes mellitus were excluded from this study. Results and discussion. We enrolled 246 patients. The main age was 54 plus minus 10.59. The majority of the patients were male, 72.5%, and 27.5% were female. About 39.4% from the patient were from Sana'a, and 60.6% from other governorates. That means Al-Thawra Hospital, the cardiac center at Al-Thawra Hospital, is the main referral cardiac centers for all the Yemeni patients whom recommended to do CAJ procedure. Non-diabetic patients were 124, and the diabetic patients were 122. The diabetic patient subdivided into 3 groups. Less than 5 years were 57, 5 to 10 years were 25, and more than 10 years were 40. About 80% of diabetic patients didn't take any medication. This could be due to lack of awareness about the diabetes mellitus, its treatment, and the complication, or due to illiteracy, or even due to the insufficient discussions and recommendations by doctors. Smoking history was in about 3/4 of diabetic patients, and this is a high figure because the smoking has adverse atherosclerotic effect on the coronaries. Hypertension were slightly among diabetic patients, and it is well documented that the association between the level of plasma glucose concentration and blood pressure. Impaired ejection fraction presented in 44.4% of non-diabetic patients and 85% of diabetic patients. normal coronary arteries presented in 33.9% of non-diabetic patients and just about 8% of diabetic patients. And according to the diabetic duration, the normal coronary arteries decreased with increased the diabetic duration to become 0 with diabetic patients for more than 10 years of diabetes mellitus. That means no normal coronaries after 10 years of diabetes mellitus. Similar findings presented in many studies done in Gulf, Egypt, USA, and Ukraine. Single vessel disease, more in non-diabetic than diabetic, and according to the diabetic duration, more with less than 5 years and 5 to 10 years of diabetic duration. Two vessels disease, more slightly among diabetic patients higher, and according to the diabetic duration, more with less than 5 years. Three vessels disease, more with diabetic patient, and increased the duration of the diabetes mellitus. Similar finding presented also in many studies done in Indonesia, India, Brazil, and Germany. Also, the left mean affected, presented in diabetic patients more, and increased the diabetic duration. Conclusion, the diabetic patients were higher incidence to multi-vessel involvement in comparison to non-diabetic patients. More diabetic mellitus duration associated with severe coronary artery disease. Normal coronaries and single vessel disease more with non-diabetic, and three vessel disease and affected left mean more among diabetic patients with long duration. Impaired left ventricular systolic function more prevalent among diabetic patients. Recommendation, patient education, and detailed explanation of diabetes mellitus, establishment of anti-diabetic programs using coming society and media facilities, free periodic screening for public to detect diabetes early, encouraging a healthy lifestyle of food, exercise, and normal weight, establishment of diabetes clinics for diabetes mellitus monitoring and follow-up. More studies about the diabetes mellitus and coronary artery diseases are advised. And thank you for your attention.
شكرا دكتورة بشرى for this nice lecture about study. next speaker نعم هذه ممتازة، والمفروض في المؤتمرات تكون دائما مش بس لكتشر عن مواضيع عن الستدي اللي تمت في اليمن، وكثير من الزملاء عملوا دراسات، لا المفروض انه يعني نقدمها كمحاضرات. next speaker my pleasure to introduce دكتور الأخ الدكتور يحيى المضواحي، استشاري جراحة الأوعية الدموية، والمحاضرة عن تكون ديب لا يحيى دكتور يحيى المضواحي. يحيى المضواحي دكتور، ايوه يحيى المضواحي، diabetes mellitus and vascular surgery.
تعال هنا. تفضل. ليش دكتور يحيى؟ ليش دكتور يحيى؟ مش عارف. ليش دكتور يحيى؟ لا قال لك المحاضر يحيى. المحاضر يحيى. ونبينا نسجل لك. يحيى